Hey there, it's Dr. Jim. I have a question for you. Are healthcare professionals at greater risk of binge eating? Who even thinks about these things? Well, I do. According to many experts, not just myself, binge eating is the most common eating disorder, surpassing anorexia and bulimia, believe it or not, and affects around 3% of the adult population in the United States. While people can develop the disorder at any age, it is most commonly seen in adults between the ages of 46 and 55. And it tends to be more common among women. Now, ask yourself this question. How many women work in senior care or healthcare in general and are within this age range? Answer, a lot. After reviewing some of the symptoms associated with binge eating, it will become clear why it might affect so many people who work in healthcare. Many individuals who have binge eating issues will often eat an unusually large amount of food and at one time, one sitting, if they're even sitting. Some will feel that their eating behavior is out of control. Other symptoms include eating faster than usual, eating until one is uncomfortably full, eating alone due to embarrassment concerning what you're eating or how much you're eating when you're not hungry at all, and having feelings of depression or disgust after binge eating. Do you eat to the point where you're really uncomfortable and then you're disgusted with yourself? Other important signs and symptoms of binge eating include experiencing anxiety or sadness about one's weight and diet choices. Some people will isolate themselves and they will remain alone and they won't let other people know about this problem. They may be unable to express their feelings, and some might try diets, fad diets, so on and so forth, without any success. And then they experience that yo-yo effect, yo-yo dieting, lose a little bit of weight, pack it on again, lose a little bit of weight. And usually things like that don't work. Here's some possible risk factors. While the causes of binge eating are largely unknown, there appear to be some common risk factors. They include a history of eating disorders. For instance, parents or siblings who have had some type of eating disorder throughout their life. Biological and physiological factors like genetics and neurochemical imbalances, long-term dieting behaviors, emotional and psychological difficulties, and age, usually beginning in one's teens or early 20s. Those are some risk factors for becoming a binge eater later. Now, here's a personal story. I have a friend who's an RN and has worked in senior care for almost 30 years. And he admits that many of these symptoms sound like his eating habits and his eating behaviors. As a matter of fact, he believes he developed these binge-like eating behaviors in nursing school, where he would run from class to class, eating whatever he could as fast as he could. So, does that sound familiar to you and your training? Binge eating is one thing. There are multiple complications that can follow. That's where it gets tricky and more difficult. Binge eating is a disorder that is accompanied by a number of possible co-occurring or comorbid conditions. A variety of psychological, emotional, and physical problems may develop as a result of binge eating. Some of these complications are due to obesity, unhealthy lifestyle, and the quality of foods consumed. For instance, high in fat, sodium, sugar, and unfortunately low in nutrients. Well-known complications associated with binge eating include the following. Suicide. Believe it or not, suicidal ideations or actions. Depression, obviously, anxiety, sleep disturbance, increased high blood pressure and cholesterol, of course, type 2 diabetes, digestive problems, heart disease, cancer, joint or muscle pain. So it's not just we're dealing with binge eating alone and that's all there is to it. Most disorders are not like that anyway. They come as a package with other co-occurring problems. So what can be done? Primary treatments include psychotherapy and the use of certain medications. Cognitive behavioral therapy attempts to help with coping and the choice of healthier ways of dealing with eating urges. Interpersonal therapy examines the quality of relationships. Relationships and binge eating. There's a connection. To see if there are, this therapy looks at the connections between relationships and dysfunctional behavior. Sometimes antidepressants will be prescribed if the clinician feels there are mood issues involved with binge eating, and there might be. Actually, an anticonvulsant drug, Topamax, may also be used to reduce binge eating episodes. Other treatments include behavioral weight loss programs, self-help strategies, lifestyle changes, home remedies, support, alternative medicine, and as a last resort, if a lot of weight is gained, bariatric surgery. So here are some of my final thoughts on this topic. Binge eating affects a lot of people, 3 million adults in the United States. It's well known that obesity is an epidemic. While the act of binge eating is unhealthy all on its own, it is also associated with a number of worse health outcomes like heart disease, stroke, cancer, and diabetes. More research is needed to understand what causes this condition and how to best treat it. So that's what I have. Are healthcare professionals at higher risk of binge eating? Let me know. Email me, as a matter of fact, jim@collinslearning.com. Thank you so much. It's been a pleasure to present this to you. Take care.